Hello, good afternoon, guys. Hi guys, good afternoon. This is your girl Rukaya again today. I'm so sorry we've waited for so long to have this live video on sickle cell and thalassemia. I've actually been kind of busy and under the weather, and then our sister, the specialist nurse that will be talking to us, I had to make sure that our time actually go well with each other's. There was a time she was available and then I wasn't, or it's either I'm available and then she's not available. That's why we have to just wait and do it today. We've got just 2 people watching. I was gonna wait for about 5 minutes, well, few minutes, to have people on the video, and then we can make a start, because I don't want our guest speaker to actually be the one waiting on people when she's joined the video. So maybe a few more minutes and then we can make it start. It's been such a lovely afternoon. Should we make a start now? Okay. Good. So I'm going to request for Sister Corinne to join us now. Let's see. No. I'm trying to request. I'm trying to get her to call in. Turn off now. No. Oh yes, I think I got it now. A request for you to join in, please. If you can accept and come online. Can you please accept the live the video request says? I've sent it to you. You might probably have to check your inbox. Our guest speaker is she's not able to join in, but she's actually watching the live video right now. Let's try again. So we'll be talking about sickle cell and thalassemia today. It's a very wide and broad topic to talk about. You know, okay, is that for me? Yes, sis. Can you please accept to join? Because I've sent you the request, and it says on my screen that it's waiting for you to accept it. Sickle cell is a wide topic, you know, which is probably going to take a while to discuss it. We can't finish it. It's a topic, is a discussion that goes on, and because of how wide it is. What are we gonna do? Let me try again. What are we gonna do? I don't know. How do I accept? I think you need to just maybe check your inbox and then you can respond to the link. I've sent it to your inbox twice. I can't see any request. I'll send it again. I've sent it again just now. And another thing you can do, if you go on the screen, on your screen, at the bottom of the screen, it's going to tell you join in onto Adiola Elegance video. You can join from clicking on that. Oh dear. It says you're not able to join. I believe the inbox should try with my phone. Okay. Or were you trying to get on it on the computer? I think the video is a bit dark. Sorry, guys. For those that are just joining us, good afternoon. This is okay. She says she's trying to use her phone to join now. This is Health Talk with Rukky, and today we'll be talking about sickle cell and thalassemia. Our guest speaker is trying to join in. I think she's having trouble using her computer, but she's just gonna try using her phone now. So I'll send her the request again. Yes. We'll be talking about sickle cell and thalassemia. The guest speaker is trying to join in. I think she's having trouble using her computer, but she's just going to try using her phone. Hello, Dee. Good afternoon.
Can you see me?
Yes, I can see you.
Oh, should I close the computer then, or leave the?
You can just leave it. I can. Can you hear me?
Yeah, I can hear you fine.
Yeah, so I can hear you and I can see you as well. Thank you so much.
No problem. Oh, hi.
Oh yeah, I think you should off the computer because I can hear my voice.
Oh, okay. I think it's better on the phone. Let me just close the computer.
Yeah. Please.
Okay. Can you hear me all right?
I can hear you.
Okay, I can hear you fine. Yeah, that's fine then. Okay.
And I can't hear myself anymore. That's fine. Good afternoon. Thank you so much for joining in. Can you please introduce yourself to our viewers, please?
Okay. Hello. I'm Corinne. I'm a sickle cell nurse specialist. I've been working with patients and families with sickle cell for a very long time now, nearly 15 years. And I currently am a community nurse specialist. So I work with children in the community of Waltham Forest in London. And I'm linked to Bad's Health Hospital.
Thank you so much. So today we'll be talking about sickle cell. And, you know, sickle cell is such a big and wide topic that if we start talking about it now, I don't think we'll be able to finish today. But in order not to take too much of your time and the time of our viewers, I would leave you to make a start and tell us a few things on, on sickle cell. I've actually posted a few slides on my page, I think sometime last week, for people to read on it and digest, get themselves ready. If they've got any questions for us, then they can prepare themselves. This is what I do. I make a few slides on my page, and then I get people or myself to talk about the topic about a week or a few days after. And then that gives people the time to prepare themselves if they've got any questions or anything they want to talk about, or anything they would like to participate. Nobody knows it all. So I'll leave you to take the lead, please.
No, but as you say, it's there's a lot that you can talk about when it comes to sickle cell. And,
yes.
And there's lots of different aspects of it as well. So
yes.
It depends what people on the live want to talk about, really, what the questions that they have. And maybe we can take it from there.
Yeah, that's fine. So, what is sickle cell? Can you please tell us what sickle cell is? What the condition is about?
Okay. So with sickle cell, I haven't done any notes, but I should be able to do it at the top of my head since I've written a lot about it recently. So in sickle cell, so you have, as we know, it's a genetic condition. So you will have the parents are the carrier of the genes for the sickle cell. So, and we know that it gets its name from the abnormal shape of the red blood cells. So with us, with people that have normal hemoglobin, so it's a condition that affects the hemoglobin, which is it affects the red blood cells, but is the substance inside of the red blood cell, because some people get it confused with blood group, but it has nothing at all to do with your blood group. It's actually inside of the red blood cell. So you have two people affected, the mom and the dad, and then they can pass it on to the child. So normally they are both carriers. So we call their blood group AS, which is they have a normal hemoglobin, which is a hemoglobin A, and then a sickle hemoglobin we call it. And so they can either pass on normal hemoglobin to their baby, or the baby can inherit two S's from the parents. Sorry, my phone keeps falling down. So yeah, I mean, as we know, there's no cure. Well, bone marrow transplant is the only cure for sickle cell now, at the moment, but there's a lot of research going on, and maybe in the next 10, 15 years, they might find the cure. And
Yeah.
yes, yes.
Okay. So, thank you so much for that. One second. You know, back in Nigeria, we have a lot of patients with sickle cell disease, and it's a bad, well, people make it look like it's a bad disease or it's a bad condition because of the stigma. There is a lot of stigmatization on sickle cell back in Africa. I wouldn't say Nigeria alone. I believe it's common in all the African countries, because there is stigma on it. People tend to move away from patients that have sickle cell disease. They tend to, I know of children that get bullied in school, maybe primary school. It's more common in secondary school children that get bullied because they've got sickle cell disease, and I don't blame them. I think it's because of the mentality, because of what people has at the back of their mind that sickle cell is a very bad stigma, like someone just said now, which there are so many cases of sickle cell patients, having suicidal thoughts, or people not just having the suicidal thoughts that actually go on and commit suicide just because of the stigma they've got around them. Even families as well. Families do, talk back at them about the fact that they've got sickle cell. And I think one major reason for that is probably because there isn't enough treatment and awareness of what sickle cell is. Here in the UK, we've seen a lot of children that have sickle cell, which you wouldn't even know they've got sickle cell disease. It's not like it's a death sentence. Back in Africa, they make it look like it's a death sentence. Do you understand, sis?
Yes, yes. And I think it's the lack of knowledge and the lack of
Yes,
understanding, really. That's why there's a stigma. With everything, people fear. If you don't have knowledge, then you will fear the thing, isn't it? It's similar to
yes,
what's going on now with that pandemic. We don't have the knowledge, so we fear it. So I think in Africa, maybe the knowledge is lacking, because people with sickle cell, I mean, as you say, they look normal. In the most of them, you wouldn't even say that they have sickle cell. I mean, we have a child on our caseload who is he's a professional dancer. We have lots of children doing very, 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 very well with sickle cell. But I guess the care and the treatment is a bit different in Africa. But here
yes.
we try to educate, do a lot of educational material for schools and for families. But there's still a bit of stigma here as well, because some families, they
Mm.
don't accept
Oh,
the
yeah.
diagnosis very well, and they don't want their
Okay.
family members to know about
No.
it. Yeah.
Yes, that's right. That's right. So, what would you advise to excuse me? What would you advise parents that have kids with sickle cell disease, or the public in general, on their thinking? Because I believe some of the people watching us right now, I believe they have that mindset about,
Mm-hmm.
on the back, the other side of sickle cell, that is a bad disease. They wouldn't, some people might not even want their children to associate with a child that has sickle cell. Do you understand? What do
Yes.
you think you can say? What can you advise us, those people watching it? And I believe this video is gonna go. I'm gonna post it on my YouTube page. Is Health Talk with Rukky. So many people can watch it, and I would want them to learn, maybe to take one or two things away from this live video this afternoon. What can
Mm-hmm.
you say? What kind of advice can you give, please, on the stigmatization of sickle cell before we go on to another point?
Okay. So, I mean, for the stigma, I think it's understandable that when somebody have a baby, they want the baby to be healthy, you know? But at the same time, you know, it shouldn't be something, if your baby has sickle cell, you shouldn't be ashamed of that. It's you know, it's just like a condition like, say, asthma, like cystic fibrosis, and people not ashamed of them. So why would you
Yeah,
be ashamed? And if you're ashamed, then the child will be ashamed. You know, she'll think she's abnormal, something is
true.
wrong with her.
That's true.
Yeah, she does. She thinks she cannot take part in sports. She cannot be with her friend. Why is my eyes yellow? You know, why am I? But you have to make it part of their life from since they're little, since they're small. You have to, you know,
Okay.
try and do it into stages. Say if their eyes is yellow, explain to them is the jaundice. You know, the breaking down of the red blood cells, and because their body cannot get rid of the bilirubin, then their eyes is a bit yellow, and they can drink a lot. So drinking will help them, you know, so that
Okay.
they won't be feel different from their peers. So it's just making it
Okay.
part of your life. Don't be ashamed of it, because the longer you live it, is the more difficult it will become to integrate it into your day-to-day life. And it has to be, because it's a chronic condition and it won't go away. On it, you know, you have to try and live a normal life as possible, and know that it's something that you live with. This is not something that dictates how you live your life
So
with your
live.
child, you know,
Yes.
because at the end of the day, every child is special and unique. And you have to treat the child, because there's nothing much you can do about the condition that they have, unless if you go for a
Yeah.
bone marrow transplant, which, you know, it doesn't always cure the disease. There's a
Yes. And
phase
it's such a
for
long
that.
wait anyway to get the bone marrow transplant.
Yeah, yeah, yeah.
Okay. Thank you. Thank you. Another question I've just picked from what you said. From what age can we tell a child that has sickle cell what he or she has got? What age does the child have to be before we can tell her that she's got sickle cell disease? This is what you have to do. This is how to look after yourself. This is it.
Yeah,
And I believe, the child would have been given the prophylaxis dose from maybe from 3 months,
from 3 months.
and
Yeah.
the folic acid, yeah, the folic
And,
acid and the penicillin. So he or she would have been in the habit of taking the medicine like every day. But
yes.
then, she's gonna have a knowledge of her taking the medication. But
Yes.
then,
So why is my
as she's
sister not taking the medicine? Why is my brother not taking? Why is me that taking
exactly,
this medicine?
exactly. So
Yeah.
from what age can we tell the child, please?
I would say from the time, because parents know their children best, you know, from the time you think your child can understand, you can get little books for them, you know, that explain it in simple to understand languages. You know, when you out and about, just bring it into normal conversation with the child. And you guide by what your child, how you think your child, you know, some children develop much quicker than others, and some are a
Yeah,
bit slower to
yeah,
take things in. And
yeah.
of the children, especially when they've been in and out of hospital, they are very, very, very clever. They know more about the condition than you or yourself as a nurse
Yeah,
knows, because they're
yeah,
curious. They want to know.
yes.
Yeah.
Thank you. So, averagely, what age do you think you wouldn't be able to tell a 4 years old, right, or a 3 years old or a 5 years old that he or she's got sickle cell? Would you?
Well, you wouldn't say it like in such terms, like you have sickle cell. You'd probably say, "Oh,
Okay.
your blood is a bit different from your brother's." You let them draw the shape of the blood cell. You know, you see
Okay.
that's the shape of your blood. That's your brother's blood. That's your sister's blood. And sometimes you
Okay.
have to take the penicillin so that you can get more of what your brother has, which is the better blood. You know, you try and use words that doesn't negative connotation to
Share
them, you know,
them.
like bad
Yes.
blood. You just say maybe it's the
Oh,
better, the more healthy blood. That's why you have to drink, and then that's why you get like a little pain sometimes, because your blood gets stuck because of the shape. You know, there's nothing wrong with you. You're just little bit different. Yeah. I think
yes.
again, it depends on the child.
True. True.
Mhm.
That's true. Thank you. And I just picked up another question. Our viewers in the house, please type in your questions. We can see it and then we can answer your questions. Don't wait for me to, you can just keep typing your questions and then we can treat them as we go. And I've just picked up another question while you were talking. You talk about the yellow eyes.
Yes, jaundice.
My own, I'm not, yes, before now, I just saw the colored eyes. I know it's part of the condition, but I
Yes,
never knew just normal jaundice, the bilirubin level. I didn't know that's what it is associated in with sickle cell patients.
yes, yes. So is the bilirubin is the bilirubin level, because what happens when the with the sickle cell, the bone marrow makes a lot of new blood cells, you know, all the time. Like we say normal cells, it has a turnover rate of I can't exactly remember, I think 120 days, and with sickle cell it's probably much less than that. So you have, you know, like when babies born and they have jaundice, they have lots of new
Yes,
red blood cells. And
yes,
so that's part, the bone marrow is always trying to compensate for the lack of normal shaped red blood cells. So it keeps making. That's why we have we give them folic acid as well, because the folic acid helps the bone marrow to make the new red blood cells, which
yes,
is better than the sickle cell because it carries the oxygen better. So
okay,
yes,
thank
but the
you.
body cannot break the bilirubin. The body cannot get rid of the bilirubin as quick as the bone marrow is making it. So that's why they have yellow
Okay,
eyes.
okay, so it's just normal jaundice, right?
Yes, yes, normal jaundice. So if you go for a blood test with sickle cell children, you'll always find that their bilirubin is very high and their skin is always, well, with Afro-Caribbean children, you don't really see the yellow tinge of the skin as such. But say, like recently, we had a child in hospital and mom said the child looked more yellow than normal, and the child eyes. And when we did the bilirubin, it was nearly 5,500.
Wow.
Yeah.
Okay. Thank you. What is the importance of the well, you just mentioned the folic acid. What is the importance of the antibiotics, the penicillin dose for the people that does not know what the antibiotics does for sickle cell patients, please?
Okay, so the antibiotics, penicillin, it prevents pneumonia. Basically, that's what it does. Because if children with sickle cell get pneumonia, it can actually, it can actually kill them with pneumonia, because they get we call it sickling in the chest. They can sickle in the chest when they get pneumonia. So this is one of the things that we have to try and protect children from a very, very early age of, because earlier on in Africa, a lot of children used to die with sickle cell, but the underlying condition used to be they die because of pneumonia, really. So that's where the research came from, which was done years and years and years ago, which probably need updating, really, because we go in on the same doses that they give the children in this research years and years ago. And it just has been one of our protocols to always start the penicillin at very young age,
Wow.
from 3 months old. So
Okay.
yeah, so
So
it's basically just pneumonia. It prevents them from having nasty chest
okay.
infection.
Oh, so the death associated with sickle cell death is just from pneumonia, not because of the sickle cell shape, not because of the shape of the cell, right?
Yeah. So you mean like death in general, or what do you mean, like?
Yes, yes. I used to think the children that died in the past from complications of having sickle cell, I used
Mm-hmm.
to think it's because they've got the sickle cell cells,
Yeah.
sickle cell.
Yeah.
That I just think that's the main reason why we've had death, but not
Mm-hmm.
now. I've just realized that it's because they have pneumonia from.
Yes. I mean,
Okay.
with sickle cell, I mean, you don't really die of the sickle cell as such. You know, you will normally die of an underlying something that the sickle cell cause. You know, like say anemia. It's not because, and then you have your blood. So in the UK, we will do blood transfusion to prevent deaths from anemia. So we will give the penicillin to prevent the deaths from the nasty chest infection. But pain, which is the main symptoms of sickle cell, I mean, people don't really die. Maybe they would say they die of pain, they're dying of pain, but you know, logistically, we wouldn't say somebody's dying of pain. So pain wouldn't really kill. Pain, which is the main symptoms of sickle cell, wouldn't kill. It wouldn't really kill someone.
With something else.
Pardon?
The pain will be associated with something else, or
Yes,
as a
something
result of
going
an
wrong in the
underlying.
body. Yes,
Yes.
So if they sickle in, maybe they have a bone crisis, a bony pain, they have a hip necrosis, you know, when the blood supply is not getting into the hip joints. We have some children in the UK to get that. And then we have anemia. Obviously, if your hemoglobin is very low, then your rest of your organs in your body wouldn't be getting the oxygen that they need to function properly. So your oxygen will be low. That's why we use oxygen, you know. So that's why you see a lot of deaths normally occur in the less developed countries, because they don't have this care and treatment. But in the UK, the life expectancy is like normal life expectancy now for a sickle cell person.
Good. I had a mom I think maybe 2 years ago, that asked me if I know there is any what's the word? Anyway, the child doesn't eat well as it should.
Yes.
So he was admitted to the hospital for infection there also. So mom was like, Rukky, do you know there is any similarity or anything that had to do with sickle cell? Like, the child doesn't eat well. So she was like, can it be because he's a sickle cell patient? And I was like, to be honest, I don't think so.
Yeah.
Do you think you have any similarities or anything in common? Sickle cell and reduced oral
picky eaters. Yeah. I mean, to be honest, we have a lot of children on our books. We have to refer them to dietitian. I mean, with the sickle cell, a lot of them, they are picky eaters. Mainly, I mean, what we say that when you have iron in your body, it stimulates your appetite. And because most sickle cell children, their hemoglobin is always very low. You know, like you and I, it might be 14, 15, whereas a sickle cell child is about 6, 7, 8, and that's normal for them. So it always registers low when you do a blood test. And if you have a low hemoglobin, it doesn't really stimulate your appetite. So you most of them are picky eaters. Most of them don't gain weight very well because their body is using so much energy because of the sickle cell. They don't have, they don't have energy to use for growth and development. So some of them, we have to give them some growth, some sort of a boost to get them into puberty. Yeah, and some of them, they also have something called pica, which is when they eat. Pica is very common in sickle cell. I don't know if you've heard of pica before.
No, I haven't.
Okay, so pica is when they eat inorganic substances. You know, like when they're pregnant, sometimes they have feeling for eating foam and things like that. Children with sickle cell, their body tells them to eat strange things sometimes. It's very common, actually. We had one child that almost ate the whole sofa. His mom used to say to us,
the whole what? I didn't get that. What did you say the child had?
It was a car seat, and he used to pull the foam off the sofa and he used to eat the foam. Yeah, but he couldn't help it. His iron is so low, his body is telling him to eat inorganic substance.
Wow. So the pica, is it spelled P-I-C-K-E-R? The pica, is it spelled P-I-C-K-E-R?
P-I-C-C-A.
P-I-C-C-A.
Yes.
Okay.
Hang on, let me just double check the spelling quickly. I think P-I-C-C-A. So you can do a bit of research about that. if you want to. But
Mm-hmm.
again, sickle cell affects children differently. So some children will have lots of symptoms and different PICA. That's speaker PICA.
Oh, PICA.
CA,
Okay.
eating non-food objects. Yes. Um, Again, so as I said, sickle cell affects every child differently, every individual differently, every adult differently. Some children, they are absolutely fine with sickle cell. They have their penicillin, the folic acid, and we just see them like once a year. Whereas some other children, you know, we see them more often. They need monthly blood transfusion. Every month they need blood transfusion because they have so much pain. But I think if you do the basics, keeping them hydrated, penicillin, make sure you, as soon as the child say they're in pain, then, or as soon as an adult is in pain, they try and give the paracetamol and ibuprofen, because they don't. The sickle cell pain is a different sort of pain. If you leave the pain, it won't go away. Like if you have a headache, you lie down, you rest, it go away. But with sickle cell pain, you have to hit it on the head. As soon as you get the pain, you have to start doing things to get it to go away. Otherwise, it just gets more and more and more because of the mechanism of how the pain is. Yeah,
Okay.
yeah,
Thank you.
okay.
Is there any other treatment? I know there is the antibiotics, the penicillin, we've got the folic acid, and then bone marrow transplant is, but that's not, it's not guaranteed, it's not common. They have to wait for a long time. And even after being able to be accepted to have the bone marrow transplant, there isn't 100% assurance that it's going to work. Is there? Yes, and I know there is hydroxycarbamide.
Hydroxycarbamide, that's a fairly new thing. I mean, in the US, they've been using it for all children diagnosed with sickle cell from the age of 15 months, I think. 15 months to
Okay.
2 years, yeah. But here in the UK, we were a bit slower to take it up, because the US always get things quicker than we do in the UK when it comes to health, because they pay for their health care, it's more, there's money involved.
And
Um,
then I think I know, well, the hydroxycarbamide is to replace more fetal hemoglobin,
yes,
but then
baby
I think
hemoglobin. Yes.
there is risk. One of the risks they said is associated with hydroxycarbamide is it affects fertility in the child when the child grows into adulthood.
Yes,
What do you
yes.
think about that?
Yeah, it
What do you
does.
have to say to
It,
that?
it does. It does affect fertility. So hydroxycarbamide have got some risk associated with it. So the main one is that it is a chemotherapy drug, actually, hydroxycarbamide. So it's never been used in sickle cell before. So it's now you have all the research coming along that some some people are for it, some people are against it based on research. But the main problem is that it can, because it's a chemotherapy drug, it can affect the white blood count and the neutrophil counts. And when you have, and the platelet counts as well in the child. So we have to, when we start a child on hydroxycarbamide, we have to do their bloods 2 weeks, 4 weeks, 6 weeks, 8 weeks, and then every 3 months after that, just to keep an eye. And the doses, we start a very small dose. But for the children that have it, it does work very, very well, because it helps the body to make new red blood cells. It works in the bone marrow, and and it helps to bring up, as new red blood cells is called, it's fetal hemoglobin. So it's baby red blood cells, baby
Yeah.
hemoglobin. And that hemoglobin, as I say, it's a protective factor. It helps, they have less, from what we've seen that they have less hospital admission. We use it for some children that have high, we call it Dopplers. Like, so with sickle cell, we have to do their brain scan every year. We have to check the brain scan because people can sickle in their brain. But that's
In
mainly
the
for
brain.
children, yeah, in the brain. So we have to do that. We call it a Doppler scan. We call it TCD,
Mhm.
transcranial Doppler scan. So
Mhm.
it helps. So hydroxycarbamide, it has been shown to reduce the pressure. So with the Doppler scan, we measure the pressure of the flow of blood in the brain. So hydroxycarbamide reduces that pressure. So it helps protect children from stroke. It helps with the pain, less hospital admission, and some children have very good appetite on it, and they grow very well on it. They have more energy, more hemoglobin. And so when we test their blood, we can actually see, we can test something called the fetal hemoglobin. So we can see it increasing when they take the hydroxy. And those that have high fetal hemoglobin, they do much better than children that are not on hydroxy. But again, it has the side effects. And fertility, mainly in boys, is one of the main side effects that we're concerned about. So we have to, if we put a boy on it, a male person on it, then we have to counsel them in terms of we have to try and counsel them, and sometimes we can like harvest their sperm when they are that age and freeze their sperm so that when they're ready to have babies, then we can we can use that. And with the girls, they have to stop taking it for a period of time before they get pregnant.
Okay.
Yeah.
Okay. But then it's always been, well, it's mostly been suggested to children that has a lot of hospital admissions, that has a lot of crises. Is that correct?
Well, in the UK, that's how we use it in the UK. But in the USA, they offer it to all children diagnosed with sickle cell. So if you have a child with sickle cell, you can actually talk to your doctor, your GP, and say, "Oh, I want my child to try hydroxycarbamide." You know,
Okay.
they just don't advertise it as much in the UK because the drug is expensive. You have regular monitoring, and it's the NHS that has to give it. So, so when you come, cost will be part of it. So for the children, that it works very, very, very well.
That's good. I was gonna say two things. And firstly, what do you advise people, like young couples that trying to, I could remember, when I posted the topic on your page 2 weeks ago, someone, someone attacked me. Yes, the lady attacked me, and she was like, why do you have to say they can't get married? It's just an advice. Back in Nigeria now, what they do, if they have a lady and a guy that wants to get married, before they accept them to come and get married in the church or even in the mosque, they do tell them to go for their blood tests to be sure they've not got sickle cell traits, or maybe the other person has got sickle cell traits and then the other one has got the disease. They always want to make sure they're clear. And then after that, then they can now go ahead with the ceremony. Well, here in the UK, there is nothing like that. You can get married to whoever.
Yeah, but if you love someone, can you say to someone that you both have sickle cell traits, so you're not allowed to marry? Would you say that to someone?
Yes. African mothers and dads, African parents do that. They tell them, you've got sickle cell traits, your husband has got sickle cell traits, we can't accept you both to get married. They do that, and it has actually ruined lots of lives.
Yes.
It ruined lots of lives, which they shouldn't. It's your place as a mom or as a father to advise your child on what to do. But it's not for you to mandate it. You can't impose your own thinking. You can't impose what you want on your child. Fine, you're the mom, you're the dad. You have the right, you have the responsibility to advise your child and to teach them what is good and what's not. But then it's not for you to actually dictate what happens in their lives. And this is where African parents get things wrong. They believe I'm your mother, I'm your father, I can tell you what to do with your life. But it doesn't always work out like that. I'm a mom, my kids are little, my kids are young. Someone says it happens to one of our friends. African parents do that a lot, and it's very, very common.
But again, in Africa, it's the stigma. It's the stigma, isn't it? It's the stigma associated with the condition. But I personally think, you should. It's like telling somebody that they have two cystic fibrosis genes, so they shouldn't marry. Telling somebody that they will get diabetes in the future, so they shouldn't marry. It's just a condition, and I mean, it's a difficult one, isn't it? It's a difficult one because I have seen children suffer a lot with the sickle cell. I mean, one child was saying to me, it's like the pain is like the feeling is like being chopped inside with a sharp scissors. You know, she said to me, she was lying on her bed. So when you hear things like that, you're thinking, why would someone want to
It
bring
makes
a
you
child
sad.
in this world to suffer like
Mm.
this? But who am I to
You can't
say?
help it.
You know, who am
There
I to
are
say?
situations where
You
you
know,
can't help.
you,
You can't help it.
no,
You know, even parents that lives here in the UK, Nigerian parents, I'm talking about Nigeria now. Nigerian parents that lives here in the UK, they still do that, sis.
I
And they've
know.
been in the UK for such a long time.
Yes,
They're
yes,
exposed.
yeah,
They are exposed. They know, you know, most especially being in the UK, they know we have loads of opportunities and treatments and
yes.
things, you know, that they do to look after sickle cell kids.
Even a
But they
cure,
should still
yes,
take
yeah.
it easy. Yeah. You
Mm-hmm.
know, for the fact that they live in the UK, they should be more exposed. They should know
Yeah,
what's going on, but they still do it. And then at the end of the day, later on in the future, the lady might not even get someone else to get married to. So
yeah,
he or she is going to remain single. And whose fault is that? And then
yeah,
at the long run, she's going to put the blame on her parents that, see, I'm still single at my age, at 35, I'm still single. I
yeah.
could have been married, if not because you imposed what you want on me. And someone says,
Parents
I
are trying
believe
to
our
be
parents,
careful.
yes, but it's our lives.
That's true. That's true. You know, I mean, it's a difficult one. If you love someone, can you say to them, and they shouldn't marry because they have this condition? And a lot of people living with the trait, and they don't even know that they have the trait. In the
Yes.
UK, you know, it's when they get pregnant, and we do the
Then
blood
they go
test.
for pregnant, the
That's
blood
when
test.
and then it's late, and you say to them, "Oh, the man has the trait as well." So then we counsel them and we say, I mean, the NHS guidelines is to say to them, you know, they have the option of terminating the baby. That's what we have to say to them based on the guidelines that the NHS gave us. You know, we give them the option of going for counseling in the hospital, and that's when they take the sample from the baby. They can do that, and then that has risk. They might lose the baby in that case as well. So most of the women, they just choose to have their babies, to be honest, because a lot of us are religious people. So you know, we just try and pray and leave it up to God. Who are we to play with the ones of us that believe in God? You know, who are we to play with God's work? You know, if God,
Yes.
you know,
And, you know, my sister here says, speaking from experience, she has 3 sickle cell patients in her family. That's a lot.
yes,
That is a lot to have in one family. And that's why she said she believes her parents are just trying to be careful. Yes, they're trying to be careful. But having said that, there are lots of other medical conditions that are more deadly than sickle cell. For
true.
example,
It's true.
cystic fibrosis. Cystic
Yeah,
fibrosis is more
of
deadly and
course.
more infectious
But
than
the
sickle
life
cell disease.
expectancy is much, much lower than children with sickle cell.
Exactly. Exactly. Excuse me. You know, and
Mhm.
even working with children, oh my God, we've seen a lot of cases, a lot of conditions that
Yeah,
children have. You know, you just be wondering, where has this come from? Where has this come from? How come? How managed? But then,
yeah.
like you said, things happen and we can't question God. We just can't.
No, the thing is, we don't. Most of us, most people, they carry the trait and they don't know. They don't know.
They don't know.
It's only in 2004 the government started to do this blood test for in the UK for pregnant women. Before they never, they just have the baby and that's it. If the child has sickle cell, based on the heel prick test, then they just get on with it. But now we have to call them in as a couple, counsel them, tell them what sickle cell is, and then we give them the choice. It's all about choices. I guess the parents can talk to their child and say, but then say to them, it's up to them because they're the ones
Exactly.
that will live with the condition, with the child, with the condition. But it is difficult having anyone with sickle cell. I mean, it's a chronic condition and it's so unpredictable. 1 minute they
You
all
never know which child is going to be a well sickle cell child,
yes.
or which child is going to be a child that's going to have lots of crises and then having lots of admissions in a year.
Mm-hmm.
You know, we
Yeah.
don't know, but we just hope. And then, in as much as we're able to carry on with the prophylaxis dose, do the safety measures, always keeping the child warm, eating good food, taking lots of fluids, like you say, we should be able to control the crisis of sickle cell, right?
You should, but in theory, I mean, some of the moms say to me, or the adults we have on our caseload say they've done everything and they still end up in hospital with a crisis. The thing, the condition is so unpredictable. That's why
It is.
you have to do the basics, because
Yes,
if
yes.
without the basics, it would
Do
probably
your
be
part.
most worse. Well, it would be worse. They would probably end up a lot more in hospital. But sometimes
Yeah.
the cold weather, the change of weather, the
That has to do it
tired,
as well.
stress, things that can bring on a sickle cell crisis, you just have to try and avoid them as much as you can. But daily life is stressful as it is. Um, yes, it's a difficult one.
It is, it is. We've got someone that says that's why Nigerian parents tell their children their genotype, and we should always ask intending partners unless you're not a carrier. Yes. So, for example, now, for those that does not understand the question, I think what my sister here is saying is we should always ask intending partners what their genotype is. Like, for example, if I've got sickle cell trait, it's my job to ask my intending husband what what his genotype is. So if he's also a carrier, then I can make the decision, or we can make the decision ourselves. Or actually, maybe me, if we've not gotten into the relationship, if they're just friends, the lady or the guy can, make the decision of whether she wants to carry on with the person if he's also a sickle cell carrier. But if he's not got the traits in his body, then fair enough. By all means, they can go ahead.
Yeah.
I think that's what she's trying to say. And she
Yeah,
said,
she has a point. She has a point.
yes,
I mean, before you fall deeply in love, I guess but then, I mean, some people they have the trait and they don't know. That's the thing. So the man might have the trait
that's
and
the
he say,
thing.
because even some children that, because we do I call the children with the trait, so we get notified of all the children that has the traits as well. So when I ring the parents and say, oh, that your child has sickle cell trait, they always say to me, oh, the dad say no, he has nothing. He's never heard of that. He's fine. I said, well, it must be the dad because we did your blood and your blood is okay. So they said, oh no, can you send a form for that to get tested? I said, they always insist that we send a form for, because the dad always say, I am healthy, I am fine, I have nothing in my family, everybody is healthy, I don't have sickle cell trait, it's not me. So if you what you going
Nobody wants to take the blame.
yes, but most men are a bit like that because they're not very health conscious as women, I would say. So they think, oh, I'm fine. What you talking about? I carry a gene for something when there's nothing wrong with me. I'm healthy. I've had no problems all my life. Yeah.
Okay. We will soon finish. I'll soon let you go. It's been wonderful talking to you. Any questions, anyone in the house? Let's try and ask our questions now so that we can release Sister Corinne.
No problem.
So, from what we've said so far, sickle cell is a condition. It can be deadly if not looked after properly, right?
Yes.
Okay, and then we know that it happens. It's 1 in 4. Can you? Okay, it's 1 in 4 chance of having sickle, like two partners that has the traits. So
Yes.
I believe it's a 2 in 4 chances of having two children without the trait, and 1 in 4 chances of having a child with the trait, and then is 1 in 4, the last 1 in 4 in a child of 4. The
Yeah.
last one is going to be 1 in 4 with a child that's going to have the
No,
disease,
no,
right?
it's with every pregnancy. So the odds is with every
Oh,
pregnancy. So that's why you have families with 3 children with sickle cell, because it's every pregnancy there's a chance.
Okay.
Yes.
Okay.
So
Okay. So in
yes,
every pregnancy, there is a 1 in 4 chance,
one in
right?
four chances, yes, that the child will
Okay.
have SS. Um, so it's kind of difficult to explain because you need to probably draw a diagram. But so with every pregnancy, there's a risk of sickle cell. Even if you have one child with sickle cell already.
Do you want me? I've got the diagram on my phone. Oops, we've lost her. Let me call her back, guys.
Yeah, I'm there now. Can you see me?
Okay. I can see you.
Okay, sorry.
So I've got the. Do you want me to show you the diagram on my
Yeah,
phone?
you can maybe put the diagram on you have the diagram on your handout, isn't it?
Yeah, it's on the slide.
Yeah, on the
Yeah,
slide. Yes, yes.
yeah.
Mm-hmm.
So we've got 2 questions. Go on, sis. What do you want to say?
So it's just important to remember is with every pregnancy, there's a risk because some people think they have one child with sickle cell, the others will be fine. But no, it's every pregnancy.
Yes. Thank you for that.
Mm-hmm.
Can you please enlighten us on those with AC genotype, please? That's a question from one of our viewers.
Okay. So A is your normal hemoglobin, and C is we call it hemoglobin C disease. So it's not really sickle cell, it's because there's thousands and thousands of different hemoglobins actually, but the significant ones that we look at is CH. I mean, there's a few significant ones that we look at, and the S we call it sickle cell, the C we call it hemoglobin C disease. So with the C gene, you can get a child with a sickle cell gene and a C, and we call it HBSC disease. So we don't really call it sickle cell disease, we call it HBSC disease. And these children are very well because you have the C is better than the S. So the C carries the oxygen better than the S, and it's better shaped than the S. So I answered the question.
Okay, thank you. We've got another question. What about C gene? So is it the same as what you've just said now?
Yes, C gene, yeah, hemoglobin C. Yes. So it's not sickle cell, it's just hemoglobin C. So SC means hemoglobin C. It's not sickle cell disease, it's just that we call it HBSC disease. But it's a type of sickle cell. It's a little bit complicated. My battery might.
Okay.
Okay.
Okay. Any more questions, guys? It's been a nice topic. I've enjoyed it so far. No knowledge is wasted and no one knows it all. I've actually learned a lot of things with this discussion today, apart from what I know in the past. And what do we say about peer pressure? Oh, it says 19 seconds remaining. I think the video is going to go off.
Yes.
Maybe because we've been talking for maybe nearly an hour or
Yes,
something.
an hour. Yeah, I think.
Okay. So are you okay for me to call you back, please? Like,
Yeah.
just to round it up.